What are some of the reasons why people don't get adequate treatment for pain? Unfortunately, cancer pain is often undertreated, and there are several factors which contribute to this, including the reluctance of doctors to ask about pain or offer treatments. Some doctors and other healthcare professionals may not specifically ask about pain, which should be a normal part of every visit with your doctor. People in cancer should be asked if they're having pain. If they are, the doctor should stop there and deal with the issue. Some doctors don't know enough about proper pain treatments, and if this is the case, your doctor should refer you to a pain specialist. Other doctors may be prescribing medications that make them uncomfortable for fear that they might be abused. However, cancer patients are very unlikely to abuse pain medications. A second factor is the person's own reluctance. People may not want to bother their doctors with information or may fear that pain means their cancer is getting worse. Some are reluctant to report it, although they would do so because they're worried about doctors or what others might think about them because they're complaining. They may feel that if they have cancer, they're supposed to have pain and be able to deal with it without anyone's help. That simply isn't true. The fear of addiction is another major factor. It may be the patient's fear of becoming addicted to these medications. This doesn't typically happen if you take cancer medicines for cancer pain. If they're given in the right dose, there's little chance that you would become addicted. This should not be a barrier for taking care of your cancer pain. Fear of side effects are a bona fide concern. Some people fear these side effects and are afraid of being sleepy, being unable to communicate with family and friends, acting strangely, or being seen as dependent on these medications. People are often afraid to take morphine because they think it might shorten their lives. There's no evidence that this has ever happened if the medication is dosed appropriately. And although strong pain medications can cause drowsiness when you first take them, that side effect usually goes away with steady dosing. The most common side effect of opioid pain medications is constipation, and this needs to be aggressively treated prior to its occurrence with stool softeners and laxatives. You'll need to discuss this with your prescribing physician or healthcare provider.